So thank you everybody for joining us. In case you've never been to one of our SDP Connects before, my name is Judy Mark. I am president of Disability Voices United. We're an organization founded, directed by people with disabilities and family members. And we were founded by the people who got the self-determination law passed to create the self-determination program. So we love having this service for our community. For those of you who are interested in moving into the self-determination program, but you should know that we have been doing this for a long time. We're now at about 14 months that we've been having these SDP Connect calls. I think we've probably had maybe 35 of them, and they can all be found on a website that we call theinterchange.org, all one word. And you'll end up seeing it in the chat. And if you choose the one on self-determination, then you'll be able to find, if you go down to SDP Connect, you'll be able to find all of the recordings of past SDP Connect calls. So our meetings. We are now starting over since the self-determination program has gone statewide and system-wide. We are starting over at the very beginning. So if you missed last week, then I would recommend you go back and look at that recording, or the week before, where we were really giving a general overview of both the self-determination program and person-centered planning. We'll probably delve into person-centered planning a little bit deeper in the coming weeks, but we want to at least give you a way to just kind of get through all the most important pieces of the self-determination program. Today, we are covering how the individual budget and how to make a case for unmet need or change in circumstances if it's necessary. What I'm very excited that I'm not having to do this whole thing by myself. I want to introduce you all to Talene Kachadorian, who is an independent facilitator and, more importantly, a mom of a regional center consumer. And Talene and I will be presenting this today. I want to let you know, you guys need to know that I have so much going on that we normally never plan much in advance. But amazingly, I have next week's SDP Connect planned already, just as a coincidence, because I will credit Molly Kennedy on our staff for this. I met today with Susie Reckwarth, who is a staff member who is in charge of the self-determination program at the Regional Center of San Diego. And she had some really interesting takes on how the individual budget is developed. And I thought it would be good to hear it from the regional center side. I might ask an additional regional center staff person to also come. So next week will be the same basic subject matter, which is how is the individual budget developed, but it will be how the regional centers see it. We're not having all 21 regional centers on, and every regional center does it differently, but I'm giving you the better, we're going to hear from some of the better regional centers on how they do it. All right, so also I should let you know the way we run SDP Connect is that during the Q&A, you'll be able to ask questions either in the chat. And all of you know that Ed Hertzel, our program assistant, does an amazing job of monitoring the chat and asking questions that you've posed in the chat to me so that I don't have to be looking at the chat. Just a reminder, don't private message me in the chat. I will not be able to read it and run this meeting. But she will do that. But you can also ask questions by using the raise hand feature, where you do that by going to the bottom of your screen, clicking on reactions, then clicking on raise hands. Okay, so we will go back and forth between people who raise their hands and people who have a question in the chat. Oh, I forgot to tell everybody that we're live on Facebook, which means that if those of you, I forgot to do this myself. If those of you want to go in and share it on your personal Facebook page so that you can share it with others, please feel free to do that. I just did it right now on my phone. So welcome again, everybody. We are getting another great turnout. It just shows the incredible interest in the self-determination program. So right now I'm going to start a little slideshow. We're not going to spend all the time. Your questions at the end do not have to relate to the slideshow or to the subject matter. You can ask any question you want about the self-determination program. I can't promise you that I have the answer for every question you have. Virtually every week, somebody, asks a question that I've never heard before, and there's no possible way that we can. There's no possible way that we'll be able to answer everything and think of everything, but I will do my best. Okay. All right. So let's get started with the. Let me see if this works. Okay, and then we will share screen. All right, Talene, are you seeing just the just the slide? And that's it?
I am. I'm seeing the slide. And yes.
Wait, fabulous. Okay. And I will try to keep the participants open and the chat open in case somebody has something incredibly important they need to tell me. All right, so just a little shout out. This is Sydney Edmonds' unbelievably beautiful painting. Sydney Edmond is a poet. She's an artist with autism, and she has painted all the covers to all of the publications we ever do because I think she's one of the most beautiful artists I've ever seen. She also sells her art to actually make money. So look her up, please. She sells her art and on various formats, including t-shirts and all kinds of other things. And by the way, Sydney is non-speaking and types to communicate. She's pretty freaking amazing. All right, so let's get started. So as a reminder of what we talked about last week, the individual budget is just an amount of money. It is based initially on the last 12 months of expenses, not how much services you were authorized, but how much was actually spent on you. For those of you who are just entering the program, you should be asking your regional center to have to send you your last 12 months of expenses right now. So at least you know your starting point as you are having your discussions about your individual budget. Remember, it only starts with the services that you used. However, that the budget can be changed if the services were inappropriate, and that's why you didn't use them. It's only going to include what's called ongoing expenses. So one-time expenses are things like you got money from the regional center to modify your van so that a wheelchair ramp could be put in it. That's not an expense in the traditional system that would be given to you every year. So all those kinds of one-time expenses would be pulled out. Now, some regional centers are pulling out funding for conferences. That is not an appropriate expense to be pulled out. And you should say, I hope to be going to conferences every year. So please be sure to make sure that that is not considered a one-time expense. All right, so moving on. Well, actually, before I move on, I'm going to go back. Did you want to add anything initially, Talene? Go ahead.
I do. I just wanted to mention on the 12-month expenses. So there have been times when I have been handed a 12-month expense report from a potential client, or I've seen one when I was assisting another IF, where the 12-month report wasn't a trailing 12-month, but it was either a fiscal 12-month, or it was a birth year 12-month, or it happened to be an end of a quarter 12-month. That's fine if you're just doing rough estimates, but when you really get into it and you're talking about negotiating your budget, you need to start with the most recent trailing 12 months. So request a fresh one at that point so that you're using the current information.
Thank you. We're going to take questions at the very end. I see some people with hands up. We're going to take questions at the very end. Ed, can you make sure that everybody's, I see that people are able to unmute themselves, and I just want make sure that the noise level stays down so that our interpreters in Korean and Spanish are able to do their job?
My apologies. I have just resolved that. Folks, if you've unmuted yourself, I'm muting you right now. Please don't take it personally. It's just to make sure that the call stays clear for our interpreters.
All right. Thank you. All right. So moving on. So how does that budget get changed, right? Because it's not just about that it's the last 12 months of expenses, especially during this time of COVID. Lots of people were not using the services they were authorized. So how does that get changed? So there are two ways that are written in the self-determination law. The first one is called change in circumstances. So what does that actually mean? So it shows that the participant's life has changed, and so they may need more services. And by the way, I should really change this. Also may mean less services to meet their goals. So it might mean that somebody has a really significant health issue, and that would require nursing services. So that's a change in circumstance that would require an increase in the budget. But let's say you had those nursing services, but you've now gotten better. Your health has improved. And so your budget would then decrease because of the need being decreased, okay? Your budget has to relate to what would have been happening to you in the traditional system. And speaking of that, remember that your budget is based only on those limited amount of services that exist in the traditional system. So if you say, for example, we would have said this before this year, that you wanted services that were really needed that weren't out, that you weren't eligible for, like a social or recreational program, you would have been able to, you wouldn't be able to argue that because it wasn't available in the traditional system. It is now available. Yay, yay. We finally won that battle, although it seemed quite anticlimactic when we've been asking for it for 10 years. No, 12 years. So what are some examples of changes that are really easy to monitor? Remember, the change is that you would have gotten a change in your services in the traditional system. So things like you're leaving school. So you either graduated from high school or you are going on to, you've gotten a certificate of completion and you've left school. So therefore the school system is no longer in your life and it cannot provide you with with any services anymore. So the regional center takes over at that point. Losing a job. So let's say you spent a great deal of your day at a job, you lost your job, and now you really need some supports during the day from a different source. That may be a change in circumstance. Getting very sick was an example I talked about earlier. One of the most common changes in circumstance is that you're moving out of your family home, and therefore you're going to need 24/7 supports in your own place, in your own apartment. And that would obviously require a change in your budget because you've got to be able to pay for that staff to support you to live on your own. So I'm going to throw it to Talene now.
I think these are all really great. Even little things like when an individual turns 18, if they're already graduated from school, things might change. So age-related or health-related or anything that would normally change in a regular, that would cause you to reach out to your service coordinator for additional support. Even, I mean, the pandemic was a change in circumstance for a lot of us. So anything that would have been a change in circumstance in the traditional system plays a role here as well.
Thanks, Talene. So change in circumstance is very straightforward. What is a little bit more squishy is making a case for unmet needs. So let's dig into that a little bit more. So what the case you're making is that your needs are not being met in the traditional system. The kinds of services that you've been authorized for are not working for you. There's a range of reasons that can be happening. For example, let's say you were offered a day program, but that day program, there's only English speaking support staff and you speak Spanish, and they cannot find a Spanish speaking support staff. So you can't access the day program, even though you've been authorized it. Another example is that the provider is so far from your home, the service is difficult to use. So a good example of that is it's a real example of somebody that I know who was authorized social skills therapy. They lived in one part of LA and the social skills therapy was in a different part of LA. They did not own a car. And so this mom had to take her 5-year-old son on a bus with her newborn baby on a bus for an hour and a half from Hawthorne to Santa Monica to receive the social skills therapy. And then the social skills therapy lasted for 1 hour. And then they got on a bus an hour and a half back. That only lasted 1 week and the parent never took her son back. That was just an impossible thing for them to access. So this was an authorized service that they weren't able to use. So it may be that you've been authorized a certain service, but there are no providers available in your area and you've been put on wait lists. That just being on a wait list right there is an unmet need. So let's say this is really common, that a traditional service is segregated and you don't want to be in that segregated service system, segregated setting. I'll talk about my son in this example. When my son left the school system, he was offered day programs. We were given I think a choice of 3 maybe different day programs. And I took my son to visit all 3 and he hated all 3 of them. They were highly segregated, sitting in a room all day long with the same set of people. They never went into the community. They never left. He was miserable. And so he sat at home for quite a few months before we found an alternative service provider that was community-based. And so if you had looked at his last 12 months of services at that time, it would have shown he only used, let's say, 6 out of the 12 months of services. So that was unmet need because the only thing offered for those first 6 months were those segregated programs that were unacceptable to him. The other thing that's happened to him as well is that there are certain service providers who would look at certain people and say, well, we don't take that level of disability. It's actually something that is very upsetting to me because it's called cherry picking, where they pick the people that they feel the easiest to work with. And so that may mean that you can't find a provider because you have a certain level of needs. Maybe you're an adult who is still needing to wear some sort of diaper, and so they don't have a way to change you, so they're not taking you. Maybe you have certain challenges. Maybe you're non-speaking and they don't want to serve you either. So for all those reasons, you're not getting served, even though in your IPP there was a need determined. Also, this happens a lot where families are authorized, a certain amount of hours of respite per month, and then you don't have a provider. You can't find a provider. That's really common. Remember, it's only those services in the traditional system. You can't be going, I should have gotten this or that. When you could only get that in the self-determination program. There's one other way to think about unmet need, and I can't remember. I created these slides a long time ago. Maybe I'll get it to this. Yes. How do you make this case? Oh, wait, let me go back. You may have more examples, but I want to say one more thing. Sorry, Talene. A much harder way to talk about unmet needs than this is to say there was nothing in the traditional system that worked. Nothing. So therefore, we have not had a budget in 10 years, 20 years. My dear friend, Stephen Hinkle, who is not here because he's traveling in Europe, which is so exciting. He's in Denmark right now. He was a person who is getting his PhD right now, but has very significant needs. and has just been underserved for 25 years and had a budget of practically zero. So when he went into his budget discussion with the regional center, he made the case that, I don't need your traditional type of independent living services. I don't need your traditional supported living or your traditional day program. None of those things work for me. However, here's, based on my person-centered plan, all of these needs that I have that you should be fulfilling for me. And so that is a way you can make an unmet need case. It is the most challenging, but I have seen many, many people able to argue that. Okay, go ahead, Talib.
I was just going to say that when you're looking at the 12-month expenditure, there should be two numbers on that document. One is the authorization and one is the expenditure itself. And so it's really important to also look at the difference between those two as a potential unmet need, because in many cases, there was obviously a need. That's why the authorization was given, but something happened along the way. One of the most common things we're hearing right now is staffing. Everyone, I don't care whether you're walking into TJ Maxx or McDonald's or Arnie Morton's, everybody is hiring because there just isn't enough staff out there. Well, the same thing holds true for our service providers. They've always struggled with finding quality people, but now they're struggling to find people in general. So a lot of the spending plans that we're seeing, or a lot of the expenditure plans that we're seeing, the 12 months are, it's very obvious that there was a need that was unmet. So that's one thing to keep an eye on. It's very easy to explain that. And I think the regional centers at this point understand it. In many cases, the regional centers who are really involved with self-determination are making that clear up front before you even say anything. So that's a good thing, but just in case they don't, wanted to bring that up. The other thing I was going to mention, along with what Judy was saying about the spending plans, those individuals who had a zero spending plan or a zero budget before self-determination, as you're coming in, it's the person-centered plan that really drives everything. So if that's done with all your heart and soul, and I know sometimes it's very hard for self-advocates to be brutally honest with the things that they need. But if it's done correctly, and if everyone contributes the way that they're supposed to in a person-centered plan, the unmet need will find its way to the conversation, and it'll be really easy to be able to explain what it is that's needed.
Thanks, Talene. Okay, so how do you make this case? So people are often wondering, like, how do you find out what services your regional center offers? And remember that not every regional center offers the same services, which is very frustrating to me because this is a statewide system. I call them geographic disparities, where you can live on one side of a road and be in one regional center where you get access to certain services. And if you live on the other side of the road, you don't have access to those services. That is extraordinarily problematic for me. But regional centers are required by law, by the Land Term Act, to post all of the services that they offer on their website. And so if you go onto your regional center website and look, I mean, they're all different. Sometimes it'll say, for consumers, or sometimes it'll say services. You'll see the list of the services that are offered at your regional center. You should know that for children still in the school system, there are very few services available. It's basically respite, after school care, and sometimes nursing services if it's needed, behavioral therapy for people who don't have autism, because if you have autism, you have to use your insurance, and sometimes social skills or adaptive skills training. That's about it. Maybe some conferences and parent training. Very, very few services for children. Anytime now, we hope you'll be able to access funding for social and recreational programs as well. And so if you make the case that you would want that funding will go into your budget. So, so that's the key place to start. What services are available and how can you make an argument based on your person-centered plan that you have needs for certain levels of the traditional services? Oh, sorry. These services are listed on your on the website. So remember, I was giving you that example of my friend Steven, where he would never require traditional supported living services, but he has certain needs that supported living services could theoretically provide, even though they generally don't. So we were able to make a case for a certain level of independent and supported living services for him so that he could get at least some of that money in his budget. So these are also services that you're getting now, but you didn't get enough of. So I meet families all the time whose children are getting like 10 hours a month of respite, and that's the only service they're receiving. So obviously that's really problematic, and we should be able to make the argument that you have a higher level of need. I'm happy to, after this, help folks make the argument for an increase in respite. I believe there is a clear strategy on how to do it. Although I have tried to help people with that strategy and still failed at some regional centers. I don't help people very much, you should know. Only close friends, because I just don't have enough time. But I have tried to make that argument and still failed. But you should know that a child or an adult served by a regional center should be cared for 24 hours a day. For children, there is an expectation, if they do not have a disability, that the parents are taking care of them for most of the day. So if you have an 8-year-old, you cannot make an argument that you need 24/7 supports paid for by the regional center. But if you're an adult or even a young adult, a 15-year-old should be able to be left at home if they don't have a disability, and so left at home unsupervised. So that is when the level of services should go up for you, is as if you look at a person without a disability, what would be their needs for childcare or support staff. If you need support staff at a higher level, I would recommend that you figure out 24 hours a day. You look at what you're getting in IHSS and what you're getting from the regional center, and what's called natural supports, what the parents are providing, and make the case that there needs to be a higher level for that. I just noticed somebody sent me a private message. I don't look or read or answer private messages during this meeting because it would distract me. So please put it in publicly in the chat. I appreciate that. Remember that you have to explain why these services are appropriate for you and relate it to that individual based on their person-centered plan and based on their disability. Okay, you have to look at the disability at all times. Okay, let's go back. All right, go ahead and fill in, Talene.
I think you covered everything.
Wow.
You really
Excellent.
did.
It's, I have to tell you, it's so much easier to make the case for change in circumstances than unmet need. But I see people every single day making the case for unmet need, and the regional center agreeing to that at the IPP.
And the only thing I would probably say, though, is that keep in mind that even though regional centers do or don't cover this or that, if you have a need, you need to have that conversation with your service coordinator. There needs to be a solution. If there is a gap in services because your insurance company is not able to cover something, talk to them. Even though regional center doesn't traditionally cover it, they might cover it under gap coverage. So there's always that discussion about what the need is. At the end of the day, they are still the payer of last resort, whether you're in the traditional system or in self-determination.
Right, thank you. Okay, so I'm now going to spend just a few brief minutes talking about the EVIL budget tool. So regional centers were provided by DDS something called a budget tool in order to help them have a consistent way across all 21 regional centers to calculate a person's budget. The problem is that when DDS gave this to the regional centers 3 years ago, they didn't require them to use it, and they made the budget tool so damn complicated that nobody understands it. A couple of regional centers have come up with their own alternatives to it. We're hoping to have that presented to you next week, but I'm going to give you a brief overview because it's really important that you have the same level of education, same level of training, I meant, on the self-determination program as the regional centers. And in many cases, you have a higher level of training on the self-determination than the regional centers. So what is the budget tool? So it starts with the last 12 months of expenses, that amount that you can get from your regional center with a listing of all the services and services code you received. You add the amount if the budget doesn't include 12 months of cost. So let's say you're a person who just came into the regional center system and you don't have a full 12 months of cost. They would do what's called annualize it, which is multiply 1 month of that cost times 12. Or let's say it's a service that you got authorized in the middle of your year, because let's say your year started in January, but you graduated or left high school in June and therefore got an additional amount of services starting in July. That 6 months of services would be annualized and would become 12 months of services. You then add the amount of group services. So this is super complicated and super unnecessary to even discuss right now, because what these group services are primarily transportation, and group transportation hasn't been used since before COVID. So nobody can look at their last 12 months of services and I can't imagine anybody's got group services in there, but you want to make sure you ask about it. So these group services, just to explain it super quickly, group services are things like a van that comes to your house, picks you up, then goes and picks up 4 other people and takes you all to a day program. That transportation service is not getting paid individually to pick you up. They're getting paid per day to pick up everybody. So when you have your cost statement or the last 12 months of expenses, that does not end up showing up, that cost, even though the regional center is paying for you to get that transportation service. So there are very, very few services that meet that little category. And especially during COVID, very few were getting it. Although my understanding is that some of these transportation services were continuing to get paid even when they weren't providing services, which makes my head want to explode. So definitely ask about it if you've ever used that kind of service. They then add the amount of traditional services that are new and needed because of a change in circumstances or unmet need. So when you are, so I have heard too many people say, I'm waiting for my regional center to get me our budget. That's not the way things work. Your regional center should be able to produce the last 12 months of expenses within a couple of days. It's literally a simple thing that they punch into the computer. It should be able to pop out and email to you very, very quickly. You then don't sit and wait for them to figure out your budget and sit and passively use it. That's not the way it's supposed to work. You are supposed to have a meeting with your IPP team. And when I say your IPP team, it is not the regional center and you. You can bring your independent facilitator to that meeting. You can bring a friend. You can bring a neighbor, anyone there to support you. You can bring service providers. This is a team meeting, and you, as the individual served, can decide who comes to that meeting. So it is at this IPP team meeting where you have a discussion or even a negotiation about the individual budget amount. And so it shouldn't be like waiting. You should be calling for an IPP meeting about your individual budget right away. The kind of final piece of the budget tool is that they will subtract services that you're not going to use. Excuse me. So that means, let's talk about a person who is moving from a day program all day to getting a job and using a job coach. And they do that 6 months into the year. So if you look at their last 12 months of services, for the first 6 months, they went to a day program and that was a cost. And the second 6 months, they had a job coach at a job. In the future, you would assume they would be staying at that job. And so the amount of money would be based on what the future holds, not what the past holds. So they would create 12 months out of that job coach expenses, and then they would subtract the 6 months of the day program. I'm sure some of you are like, what the heck are you talking about? It's really important to kind of understand this so that you are at an equal, you're equal in your negotiations with the regional center. Remember that they're not going to just take what's been spent in the past if you no longer use those services, but they're going to look to the future on what you would be getting, and they would add that in. All right. I'm sure you're all highly confused. So here's the way you can ask yourself to, oh, should I go back to, maybe let me finish this and then we'll have you tell me. How much was spent on the participant in the last year? Okay, that's easy. Then they add, did the cost of the service increase? I forgot to mention that. Or will the cost increase? This is huge. You have to listen to this carefully. Your services, your expenses are based on the rates of services in the traditional system for the previous 12 months. But almost every single service in the traditional system is getting a rate increase over the next 12 months. And so you should be getting the rates based, your budget should be based on the future rates, not the past rates. I just heard of too many people who are just accepting their previous 12-month budget and not saying to the regional center, wait a second, these rates went up. My budget should be increased because of that. I can tell you, even I made that mistake, because when I went back to negotiate my son's second year budget, I had no idea that during the course of that year, the rates in the traditional system for ILS or independent living services and day program services had gone up during the previous year. So we were able to increase his budget immediately, but during the negotiation, but I should have gotten that rate increase 6 months earlier on January 1st when that rate actually went up. And so you're at a disadvantage because you don't know when rates go up. I don't know when rates go up either. I'm not a service provider. So it really is important for you to be checking in with your regional center service coordinator to say, just want to check to see where this, if the rates have gone up. I can tell you that there was $1.4 billion given to traditional service providers in the budget passed in July last month. And that $1.4 billion includes funding for self-determination participants too, to be able to increase our budgets. So definitely be watching, because over the next 5 years, some service codes are going to be going up by 100%. They're going to be doubled. And so that can be reflected in your budget if you ask for it. Then determine the costs for any newly identified needs and services. And you're going to add that in. You're going to add the costs of services purchased under this group contract. And then you're going to, at the end of that, subtract services that are no longer going to be used. So you figure out the cost of those that are not going to expected to continue, regardless of whether you're participating in the self-determination program. And then you also subtract services available in the SDP, but not included in calculating the budget. Okay, let me explain that confusing thing. So there are certain services that people can get that are not going to be in your budget because they are not part of the self-determination program. However, you still get to get those services. There's only a few, and they're related to employment. The first is the paid internship program, and the second is competitive integrated employment. And those are programs that are funded only by the state of California. Everything else in the self-determination program is funded by both the state and the federal government. So if you're interested in this paid internship program, which all of you adults who don't currently have employment should be interested in, you can access that funding and it will have nothing to do with your self-determination program. Okay. This is kind of what it's going to end up looking like. I'm not even going to let you spend too much time looking at this. It is so absolutely confusing looking. And so I just want you all to be aware of it, even if you don't use it all the time, because I don't want the regional center to have an advantage over you. All right. Do you want to add anything before I move on to that, Talene? Go ahead.
There's two things I wanted to say, actually. First of all, when we talked about the increases and the rate increases, Judy, one of the things that I have found is that sometimes we don't know quite yet what that's going to be, or when, the specific dates or the amounts, or what percentage is going. So some of it is not really identified yet. So if you're writing your certified budget today, you may not know in January which of the services are going to go up or down. So don't worry, if you don't have to have it in the budget today. Just earmark it for yourselves so that come December or November, December, before the actual transition happens, or even in January, because they could retroactively add that rate increase in as well. Just make sure that it's accounted for at some point, because you can always update your budget at that point. So that's really important. The other thing I wanted to mention is on this budget tool, if you're seeing it for the very first time and it is overwhelming, don't panic. The regional center's responsibility is to walk you through it. You're not creating this document, they are, but you need to understand it and ask questions. So as they go through it and they're explaining it to you, if you have any questions, stop them and ask them to explain it. If you have your independent facilitator with you, make sure they're explaining it. If your FMS is with you, have them explain it. Whatever it takes, just make sure you understand it at that point and take lots of notes so that if you do need to make any changes later, you can.
Thank you. It's great. People are asking in the chat about getting a copy of this. We will definitely, Ed will make sure that it's up. Ed, what do you usually do? Do you usually put it on the interchange?
So I posted in the chat. I usually post it directly in the chat if I can. Sometimes the PDF is too big. If it's too big, I will send it out in an email. I can also post it on the interchange. So make sure that you subscribe to our email list, folks, and also make sure that you know what the interchange URL is. I'll post it again.
Thank you so much, Ed. Okay. All right. So finally, what happens? I know I see Vanessa, I see you, but we're not taking questions yet. Okay. We're going to take it at the end of the presentation. So certifying the budget, that is the critical thing that happens after you come to an agreement with the regional center on your individual budget amount. The reason why it's called certifying the budget is because the regional centers have to be able to say that it would have been spent on you regardless of whether you went in the self-determination program. And now with the most recent budget law that was just passed, regional centers will be required to document why your budget changed. They will, as they are writing the certification of the budget, if your budget amount went up, they will say, based on change in circumstance, individual left high school, or based on unmet need because of COVID, they couldn't access any of these services in the past year. So they're going to have to document that, because one of the things we've seen is that budgets have gone up about 20%. And the regional and the state of California is very concerned about that. And so we were able to remove all that horrible, evil cost effectiveness language so that everything you do doesn't have to be cost effective. But in exchange, what we offered is to say, let's have regional centers document why these changes are happening. And if they're legitimately, if the changes are being legitimately made, then the state of California will understand how so many people are being underserved in the traditional system. This is why some budgets have been increased. So the regional center signs the budget. It does not mean they improve how your money is being spent. It's just that they are certifying that the budget amount would have been spent on you in the traditional system, and all your needs were being met. Most regional centers also ask you, if not all regional centers, ask you to sign the budget as well. So there's nothing in the law that requires that, but it's just what it shows is that there's an agreement between the parties. It's kind of like a contract that this is how much the regional center is going to provide for you to meet your IPP goals. Do you want to see anything more about that?
I think I'm going to burst on this one. So along with making sure that you have a certified budget and the signatures that Judy talks about, please make sure that you have a copy of that signed document in your possession. Because in many cases, you have to sign it first and then it goes back to the regional center. And either they forget or they email it to you and you don't save it. Please make sure that you've documented that you have received. And right now with everything being digital, it might be that there's two separate pieces of paper, one with your signature on it and one with their signature on it. That's fine. Staple them and keep them together. Or if you're going to do it digitally, file them and save them together, or even merge two PDFs if you can to have a 2-page PDF. Whatever it is, make sure you have it, because come second year, if you don't have the right document in your hand, it could get very confusing. So please make sure you have that.
Thanks, Talene. And once again, we said this last week and the week before, that the individual budget is just a dollar amount. It is so critical for you to understand that there is no relationship between the services you receive in the traditional system that make up your dollar amount and the services and items and activities that you purchase through your spending plan. There does not have to be a tie. I am continuing to hear this misinformation out there where regional centers are requiring people, they say, oh, you were getting respite in the traditional system, so you need to draw a line and have respite in your spending plan for the same $3,000. There is no relationship. That's the whole thing about the freedom and authority that you have in the self-determination program, that are the principles of self-determination. So you have this dollar amount here, and then you can spend it. And we're going to, in 2 weeks, we'll be talking specifically about the spending plan. We'll probably spend a couple of weeks on the spending plan. How you spend your money is a totally different set of issues, and they're very exciting because there's so many things you can spend your money on, and you want to think outside the box and be very creative. I believe that was our last one. All right, so let's go to questions.
Before we go into questions, I just want to add one more
sure,
thing.
go ahead.
One last piece of advice is that no matter whether it's a spending plan or a certified budget, anything that you sign, make sure you date right under your signature, because inevitably you'll have multiple versions and you don't want to go back and try to figure out which one is which. So just make sure you date everything. Unfortunately, the certified budget does not have a date on it at the top. So if you don't date your signature, you have no reference as to when that was actually created.
Okay, great. All right, so I'm going to take a few of these hands raised first, Ed, and then we'll come to the chat. So remember that you can ask questions about our presentation, or you can ask questions about anything related to the self-determination program, but please try to make your questions related to self-determination. We're not here to talk about sort of general things. So go ahead, Ryan Duncanwood, I asked you to unmute. Are you saying hi to me? Hi, Ryan. So glad to see you. Did you have a question or did you want to type your question in the chat maybe, Ryan? All right, I'm going to give you a chance. We're going to go to our next question, then I'll look in the chat to see what your question is. Okay, Ryan? Thank you.
Thank you.
You're welcome, Ryan. It's always great to see you. Marta Chavez, you're next. Marta, you there? Okay.
¿Aló?
Oh,
¿Aló?
there you are. Now we can hear you. Go ahead.
Sí, ya, gracias. Mi hija estuvo en autodeterminación por un año y fue como un sueño para nosotros porque mi hija estuvo muy feliz durante ese año que trabajó con las personas que ella quería trabajar. Estaba feliz trabajando con esta persona y hubo un avance en ella que en el sistema tradicional por 5 años no hubo este avance y durante este año que en autodeterminación hubo este avance que no había habido en ella y estamos súper felices como papás por este año que pasó, por este año de autodeterminación, pero el problema fue cuando ya cumplió el año, tuvimos otra vez el IPP y todo eso, pero mi sorpresa fue que el centro regional me está pidiendo un reporte de comportamiento, pero yo no usé el servicio de comportamiento ya que era el único fondo que yo tenía para gastar en otras cosas que ella quería. Entonces, no tengo cómo presentar ese reporte. Entonces, el centro regional me quiere quitar este servicio. Pero ¿cómo si no cuento con esos fondos, no veo el por qué estar en autodeterminación? Entonces estoy pensando en volver al sistema tradicional. Y esa es mi pregunta. ¿Qué se puede hacer con esto de los reportes? Que otra vez las compañías quieren tener el control, otra vez el centro regional. Yo pensé que eso era parte del pasado, pero por lo visto que no. ¿Qué podemos hacer con esto?
Thanks, Marta. I'm hearing this. This specific thing is happening at Westside Regional Center. I would be interested. You're at Westside, right, Marta?
Es correcto.
Yeah. I have not heard yet that any other regional centers are doing this. So I'm hopeful that we can stop this at one regional center before it infects all the other ones. So what Marta is talking about is that for people who are getting clinical services like behavioral therapy or speech therapy that are paid for by the regional center, you get it in your budget, but they're requiring you to get a report every 6 months to ensure that those services are still required for you. I had a talk earlier today with another regional center asking them how they do it, and they definitely don't do it that way. Especially because many families are not using those clinical services in the same way. So let's say their child is getting behavioral therapy, they maybe instead be purchasing other kinds of unique services that help meet those same goals. So it might be horseback riding, swimming, exercise, meditation. All of those things are completely legitimate ways to reduce anxiety or whatever it is that might cause someone to have behavioral challenges. And, ABA therapy is not the only answer to everything. And so, I have really significant problems with it. I have been trying to advocate at Westside Regional Center to get rid of that. And I think for now, all that we can do is continue to advocate and to try to get DDS to come and weigh in on this, and hope that no other regional centers take on this ridiculous idea that doesn't actually work. Talene, have you heard this at any other regional center?
So yes, I have, and I think some of them legitimately are also confused on how to handle it, because the response I got from one of them is that they require it in the traditional system. So why wouldn't they require it in SDP? So if they were, that's where the argument is. We did have a situation in one of the cases where, and it was behavioral related, where they were receiving floor time. And so what we were able to do is put together a document that showed the outcomes as opposed to meeting of goals, quote unquote. So that was really helpful, because then the regional center can say that they had something that shows that there is some progress being made towards goals, or that there's some outcome that was that directly related back to the IPP goals.
Yeah, and that's the way it really, really should be, is that it should be related to how your IPP goals are being met. So let's say you have an IPP goal that a person will, a person's anxiety will be reduced, which will help them cope with sort of changes in schedules or crises, which may in fact produce some challenging behaviors. So that's your goal. If you're able to meet that IPP goal without using ABA therapy, but taking that funding and using alternative kinds of services, it's all about meeting the outcomes. It's not about hiring an ABA therapist. We gotta remember, this is all about choice and control. This is all about freedom and authority, and nobody should be required to use a specific type of behavioral therapy. So I hope that we can come to some decisions on that in the near future. I understand that we have Ryan's question. So go ahead, Ed.
Certainly, one moment. Let me pull it back up. I have a couple of questions from Ryan. Ryan, I'm not sure which question you wanted to ask first, so I'm just going to ask them both. I have
I think it's okay.
Got it. Okay. Thank you, Ryan. He says, how much is costs for SLS is the first question.
So, each SLS is different. There are different rates in different regional centers. There are average rates for SLS that exist on the DDS website. If you look at services and rates on the DDS website, you can see that there's an average rate. And one of the things you can do is to ask your regional center. So let's say you're moving out and you want to know how much should be going into your budget. You need to know what the rate is for that supported living services. You should ask your regional center to give you that dollar amount. You want to make sure they're not giving you a low amount. They should be giving you the average amount. Or if you have particularly high needs, they may need to give you a higher amount of money for SLS services. Sometimes they negotiate based on the level of need of that individual, a higher rate for SLS. I hope that helped, Ryan.
I have the second question from Ryan is, let me get back to it. My SLS provider, Ryan, did you want to? Sorry.
I think he said in the chat that his mom's on right now.
Got it.
So hi, Ryan's mom.
I have from Ryan in the chat, my SLS provider won't take SDS. I did the orientation. What do I do?
Well, it sounds like you shouldn't be using that SLS provider. You don't need, in fact, to use any SLS provider. You can use you can hire the staff yourself, Ryan. You can use what's called a co-employer model or the sole employer model, where you hire and fire your own workers and you're not using an agency at all. Remember that the agency rates are much higher than the hourly rates that your workers make. So I'll give you an example. The hourly rate of a supported living provider may be somewhere around $30 to $35 an hour, but no supported living service worker, the worker in your home, is making anywhere close to $35 an hour. They're generally making between $12 and $15 an hour. So where is all that other money going to? That other money is going to taxes and insurance and liability insurance and all that kind of stuff, and workers' compensation. But it's also going to pay the rent, to pay the salaries of the senior staff at the SLS agency, to pay the copy machine if they have one, their phone services, the rent on their offices. So all that administrative fees, generally around 15%, that goes into your budget. And you don't have to spend that, and you don't have to pay for the agency. So I recommend to almost everyone to get out of the agencies or to negotiate a different cost with the agencies so that you can pay your workers a larger amount of money. It helps you to maintain and keep your workers as well. And actually, Ryan's saying he travels. That's so true, Ryan. When you have an agency, I was just talking to a friend of mine about that this week, where he's going into self-determination. He uses an agency that changes shifts at 9 p.m. So sometimes he'll be at his parents' house for dinner and he'll want to stay till like 10 or 11. But since the agency changes at 9, he has to get home by 9 so that the new staff can come on. He has no freedom in his life. He doesn't have control over his life. Now he'll be able to say to his staff, I want you to come. I'm going out this night. I need you to work till 10 or 11 o'clock that night. Or I want to go to Vegas for the weekend. I need you to support me for the whole weekend. So you're going to work 3 days in a row. And that would never happen in the traditional system. So I encourage you, Ryan, to think about maybe taking it outside, or maybe looking at at alternative ways to fund the staff. You can travel out of state. You absolutely can.
Judy, also, Christiana actually posted something that I was looking at earlier today. It is the vendor rate study for each of the regional center. Mm-hmm. So it's a really great link if you guys want to take a look at what the rate study shows for each regional center specifically for all of the centers.
Yeah. So you should know that you can't count on that to the penny, guys. So first of all, it's going to be spread out over 5 years, those rate increases. The first 25% of that rate increase will go into effect in April of 2022. It's kind of a complicated way they're implementing it. And then there are some service providers who are supposed to get a lowering of their rates, but that's not going to happen to any service providers. No service providers are getting a lowering rate, even though I think the ones that we're supposed to should have. But so you won't see any lowering. But you need to really stay in touch, and hopefully the regional center will keep you informed that in April, at least I can tell you that supported living is getting a 40% rate increase over the next 5 years. So that means they'll probably get a 10% rate increase. They're getting a quarter of it. Yes. A 10% rate increase in April. So all of you who are using supported living services to make up your budget, you're going to see you should be seeing an increase in 10% per hour of your rate. Okay, I am going to go to Vanessa. You've been waiting patiently. Hi, Vanessa. What's your question?
My question is, this is my first time going on to this self-determination. Is this the letter to the welcome letter that I get? Because I got this in the mail.
You are receiving this letter to inform you that the self-determination program will be available. Okay, all that's telling you is that it's available to you. It doesn't mean you're in it yet. You still have a lot of work to do, Vanessa, okay?
Okay, my other question is, can I get services like to help me go? It's an issue for me is like, I don't have a car to get to, let's say if I want to go horseback riding. Because I don't physically have a car, and then the budget, does it include it with TIL, training for independent living?
Yeah, so are you asking, like, can you use your budget to hire somebody to drive you places?
Yeah.
Not only can you do that, yes, but you can also use your budget to use Uber and Lyft and taxis.
Okay, because I only have my mom's at my payee right now, and I have a Venmo that I use. And then let's say if the ARC doesn't want to support me in going to a ARC conference, because there's going to be a conference up in New Orleans for the ARC the national conference, and I really want to, because they're right now, because of COVID, they're not sending anybody to a conference right now. So it'd be cool if they could have something on that line of sending some people to New Orleans for an art conference.
So let me just say that traveling at the cost and expense of traveling out of state it becomes a little bit fishy. And so some people have been able to use it. I mean, mostly we've been in COVID, but I don't know. Talene, have you heard whether DDS has said you can travel out of state? I don't know where they came down on it.
Everything I've heard is that out of state is not covered.
Yeah.
But I think it also depends on your vendor. And if they're a national vendor, local, where does their insurance cover them? But everything I know is that it's not covered for out of state.
So when I say traveling out of state, you can certainly, your support staff can travel with you out of state. I know that for sure. Okay. Whether you have a national vendor or not, you can have a support staff. Yes. So your support staff could go with you to New Orleans and support you, but your travel costs, like your plane ticket, your hotel, that cannot be covered in the self-determination program. Okay.
That for sure cannot be covered.
Does the self-determination, does it cover, or the budget covers with the new directions?
I'm not sure I understand what you mean by new direction.
It's a travel agency for people with disabilities.
Yeah. So I don't think so. I don't think it would cover taking you on a vacation or some kind of trip that New Direction would take you on. But what it would pay for is, let's say you need a staff person to support you on that trip. It would pay for the staff person, okay? But not for your vacation itself.
Okay, because me and my mom have saved all our money from our stimulus checks to go on to, because I'm actually going to be going to New Orleans on September 9th to the 23rd.
Wonderful. I'm happy for you. Thanks, Vanessa.
So do I need to talk to Viviana, my Tri-County worker, about getting sorry, trying to think and my brain's all over the place.
So Vanessa, if you want to go into the self-determination program, your first step is to call your service coordinator at your regional center and tell him or her that you are interested and that you want to have a meeting about it as soon as possible.
Because I don't know what my budget is, and when you were talking, it was like overwhelming to me. Like,
so
I
Vanessa,
need to break it down really.
Yeah. One of the things I really recommend you do is to find a person-centered planner or independent facilitator. There's a lot of them on this call today.
Uh-huh.
And so maybe some of you who are, who I know a lot of them have wait lists. So for those of you who are taking new clients and are interested in this amazing person named Vanessa, that please put your information in the chat. Vanessa, what regional center are you at?
Tri-County and Oxnard.
Okay, so she lives in Oxnard. So for those of you
No,
who
I
are,
live in Ventura, but I get
Right.
services from Oxnard.
okay, so for those of you who are serving that Tri-Counties area, please go ahead and put your information in the chat. If you have an independent facilitator, they will hold your hand and help you through the whole process. So you don't have to become overwhelmed, okay?
And then
Yeah, because like this right now is overwhelming.
I'm sure it is. I'm sure it is.
That's
Judy,
why I
I
was like
wanna
getting
say-
really frustrated and like, okay, I'm waiting and waiting and waiting.
We'll help you. Don't worry.
before you go to the next question, because I know you've got a bunch of people, we only have 15 minutes left.
Right.
I just wanted to also keep in mind, those of you who are talking about traveling with your staff, keep in mind there's staffing issues. So it could cost you an exorbitant amount of money, because if they work for a company and there's maximum numbers of hours they can work, and then you've got overtime, and they have to take their breaks, they need to have a certain amount of time off. So you may need to take two people with you, so one is working while the other one isn't. It is really a lot more complicated than just saying you want to go to a conference for 3 days and take someone with you. So just keep those things in mind. Those discussions have to happen, and you have to put pen to paper to make sure that you truly are able to afford taking someone with you.
Got it. Okay, so Ed, I know there's a lot of questions in the chat. Let's get a couple of those out here.
Certainly. I have one from Susan. How do we fight for the SOE hours or PAS? During the PCP meeting, I told the group that mother requests that her SOE hours to stay put because she needs it for her medical conditions to relax, but they said no way, because they deducted the SOE from the budget and nothing else was done.
I have no idea what SOE is. Do you know what that is, Celine? Okay,
So
good.
SOE is a state of emergency hours.
Oh,
Okay.
I've never heard it
And-
called like that. Okay.
And just so you know, technically it's supposed to end this month, but I also heard yesterday they're extending it to October. And then I heard this morning that it's supposed to be a tapering off between now and October. So the SOE hours that you have should go with you during the time that we're still in state of emergency. But when the state of emergency is lifted, technically you should not have that money, whether you're in traditional or in self-determination.
Okay, so this makes my head explode, because they're tapering down our services while COVID is getting worse. And so I urge you all that if, we just had a press conference today at DVU talking about COVID and how COVID is raging again. Please, I beg all of you to please be careful out there. If you are not vaccinated, this is a commercial, real quick. If you're not vaccinated, COVID is coming for you. It really is. It's the Delta variant is incredibly contagious, and it will get you. And even if you are vaccinated, you can still get sick. I just heard of a couple today who got COVID from their son, who was also vaccinated. So you need to go back into the mode you were before, where you are wearing masks all the time and you are being very, very careful out in the community. We are hearing too many people. I just heard of 4 people being intubated this week, 4 consumers this week in just my regional center. So it's really important for you to be safe. And that state of emergency is going to be here for a while, folks. There is no possible way that it's going to go away before the end of the year. Children can't get vaccinated. So I don't even understand how they can be reducing. It's like, I don't understand. I know there's some regional center staff here, but I don't understand where regional centers moved away 50 years ago, where they were there to make sure that we were cared for in the community and that we had opportunities to achieve our dreams, to being this gatekeeper, this bureaucrat, the constant culture of no. I don't know how this happened, especially during an international pandemic. This is when people need to be kind to each other and help each other and not say no to each other all the time. Okay, go ahead, Ed.
All right, the next question that I have on the list is anonymous. Question: my son didn't use a lot of his personal assistant hours over the last 12 months because of the pandemic. He lives at home. We, his parents, were working from home, so we were around him, and we didn't have to worry about his safety in the community or need for assistance at work or in the community. We also didn't use as many respite hours because we couldn't go anywhere, and neither could respite providers. But once things open up more, he's going to need all of those services again and more. Does that constitute a change of circumstance? And how have people been making that case?
It's actually called unmet need. And regional centers have been told by DDS that they should be taking into account the issues around the unmet needs during the past year of the pandemic, that you may have put things in your spending plan, or you may have been provided certain services in the traditional system that you were unable to use, and that they should be looking at your budget from before the pandemic to start determining what you can do as things start opening up. So your regional center should not be giving you problems with that.
Thank you, Judy. So the next question that I have is from Connie. If SLS direct service providers have poor English speaking skills, both verbally and in writing, and therefore can't support their client well, how would you make this case as an unmet need?
I'm not really sure what so you're getting the service, but the service is not being provided well. So the unmet need is what? That you need to pay more to a person to get a higher level of service. And I'm not exactly sure what you're asking, Connie. So let's say the service provider is not speaking English well, so therefore you're not receiving the service at all. That's an easy case to make because it's an authorized service that you're not utilizing, because so therefore it's an unmet need. If the case is you continue to receive this service, you are using these service providers, but you are finding that they're not communicating with you well, and yet you are trying to replace them with different service providers who speak English better, and you're maybe making the argument it's hard to attract them and therefore need to pay more. That is a harder argument to make, but it is an argument worth making. I hope that helps. All right, let me go real quick. We only have about 10 minutes left. Sandra McRory, are you there? I asked you to unmute. Go ahead, Sandra. Not sure she's there. All right, we'll move on to Dora Perez Ortiz. Go ahead and unmute.
Hi, yes, I have a question in regards to the 12-month budget. I'm new to this, so I'm going to request the budget plan for the expenses for the 12 months. But I'm thinking, actually, I want to add other services that we don't have right now, like future services like transportation, transporting to the day program, and so forth. And also other things that he might be interested in. How do I budget that? Do I have to get the rates from someone?
Yes. So you don't have to get the rates. The regional center will give you the rates. You just need to know the services you're asking for. And you find those services by looking on your regional center website and seeing the services that they offer at your regional center. So
Okay.
let's say you decide that it's independent living services, it's a service you're not currently getting, but you should want, then they would go ahead and give you that rate. It's sometimes really, really hard to tell if they're giving you a fair rate because you just don't know. One way to check is to find out other people who might be getting that same service and ask to look at their last 12 months of expenses and see how much the rate is on their expenditure sheet. That's the only way for us to know if they're giving you a fair rate.
So if they do give me a fair rate and we're set on this budget and then we overspend it because the rate was incorrect, do we justify as to that they have to pay the difference, or do we end up paying the difference?
No, because you've agreed to this budget amount.
Mm-hmm.
So you can't like go back. Yeah, I mean, I guess if you find out after you've agreed to the budget amount that the rate they were giving you was wrong, you should immediately ask for an IPP meeting to change your budget.
Okay, perfect.
Okay.
Thank you.
All right, absolutely. Gabriella, go ahead. Oh, wait, hold on, Gabriela. Sandra, are you there?
Sí, acá estoy. Acá estoy, sí. Aló.
Go ahead. What's your question?
Gracias, gracias. Gracias por la información que nos dan. Yo soy facilitadora independiente. Tengo algunos casos y he trabajado muy bien con los niños. Hoy recibí un email en donde me dice mi coordinadora de servicios que están relevándome de dos de las personas con las que trabajo y no me dio el motivo y son dos personas con las que he trabajado muy bien. De hecho, las mamás me llamaron y me dijeron que no entendían, que estaban contentas con mi servicio, que querían explicación de eso, pero a mí tampoco me la dieron. ¿Es posible saber de alguna forma?
Yeah, so Sandra, I think that is a really particular thing that's related to you being an independent facilitator and not for, this is really more for participants than for independent facilitators. If I were you, I would ask for a meeting with the regional center and ask them what's going on. Because I mean, that's obviously a very specific problem to you. I haven't heard that commonly. I haven't heard that as a common problem. So definitely ask for a meeting with the regional center to try to get an explanation. Okay, thank you. Go ahead, Gabriela.
Hi. Can you hear me?
I sure can.
So my question was, you were talking about hiring a Lyft driver or Uber or even a private driver. How does that work?
So so all of you to spend your funds have to hire what's called an FMS or financial management service.
That's what I'm kind of working on next.
Right. So as you are interviewing the FMSs, you should be asking them about that. You should say, listen, I want to hire an Uber driver. How would you do that? So they might have an account that you have that has a limited, let's say you limit it to $50 a month of Uber rides. So you would have up to $50 on your Uber account, but that it would be charged to the FMS. So each one might do it differently. So you should just ask that question.
Because what if you know someone who works for someone for Uber or Lyft?
Well, you can't request with Uber or Lyft a specific individual driver, but maybe that person that you know who works for Uber would want to agree to just be your private driver. And you could put them in your spending plan as a person who would drive you, let's say 5 times a month or back and forth to doctor's appointments. So you might want to think about putting them in your spending plan if you trust them.
Mm-hmm.
Okay, great.
So
great question.
Medical appointments, what about, I go to college, would they be able to take me to college or not?
They should be able to. Absolutely. Make sure that's that's a great idea, Gabriella. I love this question. That's a thinking outside the box. I have a friend who's an Uber driver, but maybe privately they can come in and help me and drive me to college. That's great. Okay.
Yeah.
All right. Another question from the chat. We may only have time for 1 or 2 more.
Sure, certainly. I have a question from Ryan. For an FHA, a family home agency, can I open an FHA at home to provide housing for my own son when he turns 18?
So I don't think that has anything to do with the self-determination program, honestly. I don't know the answer to that question. That is, if you're talking about an agency in the traditional system, that is definitely more of a question that you should ask a regional center, your own regional center. I've never heard of a parent opening up an FHA or a family home agency. Family home agencies, in my experience, are more like foster families for an adult who doesn't have a family to live with. So I would think it would be questionable, but I'm not an expert on FHAs, and you definitely want to ask the regional center, because I don't think that has anything to do with self-determination. Go ahead. One more.
Thank you, Judy. I have from Tao, what are definitions of unmet needs in the traditional IPP?
There is no definition of an unmet need in the traditional system. It's not even talked about. It's not even talked about. So no, nothing in the traditional system. There's certainly definitions of unmet need and self-determination though, and how you go back. And that was in the presentation that I gave. All right, so maybe we have time for one more question if there is another one.
There are many. I have a question from Patty. My son does not get any services from Regional Center. In my PCP, I asked for a budget to support his social skills development and his integration needs. I've been paying for them myself. Can I use the amount I pay as the evidence I need from Regional Center to support my son in the self-determination program?
Maybe. I don't know. It's the way that they calculate for an individual, a child or an adult who gets no services from the regional center is they do what's called a mock IPP or a pretend IPP, where you're not going to actually receive any of the services that is going to agree to, but what they do is they figure out the dollar amount that comes from those services, and that becomes your individual budget. So, you know, there is no one who should have a zero budget in the regional center system, because obviously, if you are a regional center client, someone determined that you have a level of need that should be met by regional center services. So you should have a mock IPP, determine what kinds of services you would need in the traditional system. That would become a dollar amount that you would agree to, and then you can spend that money in creative ways. How you are putting out the money out of your own pocket, you can certainly use that as an argument. It may or may not be helpful to you. Talene, do you want to add anything to that? No. Okay. All right. I apologize, everybody, that we have to end every single week. We leave with questions, not all questions not answered. It's why you should always join us every week, because we try to get through as many as possible. Just to let you know, we'll be continuing to have weekly SDP Connects up until our last weekly one will be August 31st. September 1st. We will be skipping September 8th and skipping September 15th. They are both Jewish holidays that I happen to celebrate, and that maybe others here do as well. So we will skip 2 weeks in a row and be back then again on September 22nd. So looking forward to seeing you all. Thank you all for joining us, and we hope you have a really great week. See you next week. Bye, everybody.